Welcome back. Over the past few days, we've seen record-setting numbers when it comes to the number of new COVID-19 cases in South Carolina. I think it was, 542 yesterday in one day. Our medical expert, Dr. Cedrek McFadden, is joining us to talk about this increase and why we are seeing this increase and where we're seeing it. So let's start with where.
So over the country, we're seeing several states that are having increased numbers. South Carolina, North Carolina, Arkansas, Texas, even California. Within the state of South Carolina, Greenville County has been identified as a hotspot, including Lexington County and even Horry County down near Myrtle Beach. Within Greenville County itself, 30% of the cases are being identified in largely Hispanic communities, which is raising a whole nother level of questions about where that testing should be and how we should deliver that testing.
So does increased testing actually explain the spike for new COVID cases in South Carolina?
Not entirely. You know, earlier on, you could only get a test if you were severely ill. Now, obviously, it's much easier to get those tests. But according to the data from DHEC, that alone cannot explain for the increased number of cases that we're seeing. Both the 14 and the 28-day line trends actually going in the upward direction. It's today about 14% of the cases performed are positive. Wow. Rewind several weeks ago, we're just about 2.9, 2.6%. So again, more of the tests that are being performed are also positive, which cannot be explained just because we're doing more tests.
A lot of people have talked on social media about their concern that, with all the protesting that's going on and people being in close proximity, even if they're wearing masks, will that lead to more cases? Is this any sign of the numbers we're seeing? I guess it's too soon for that, right?
It's a little too soon for that. I mean, right now, the cases that we're seeing that are increasing right now are likely not related to protest. But officials are concerned that that could. Think about it. You're standing in one space for a long period of time. Now, granted, you're outside, but still, you're talking. In some cases, you may be singing. And in some of these protests where they've used things like tear gas and other chemicals, some of that encourages coughing and gagging, which also increases those risks. So many of the directors at the CDC have advocated that these protesters perhaps consider getting a COVID test if they've not done so already, and making sure they're wearing masks and staying away as long as they can from larger groups of people.
When it comes to the people who've tested positive in the state, what is the survival rate looking like? Are we seeing any encouraging news there?
Yeah, so a lot of folks are interested in that information, to have some positive news from all of this. First of all, we know that most people who have COVID-19 will have mild disease. Right. And most people who have COVID-19, they will recover. But the data to find out about recovery is very difficult and inaccurate. Because think about it, most people, if you have a flu, if you have the strep throat, you go see your doctor when there's a problem, and you may only contact that doctor if there's another problem. You don't necessarily call them and say, I'm all over it, I'm better. So we really don't have the full explanation of, number one, who's had the disease. Many people who have it don't know they have the disease. So that data is a little inaccurate to really know about the overall recovery, but we know that most people have mild disease and most people recover.
It was interesting to note that the Department of Health and Environmental Control today issued a reminder to everyone to social distance and please wear masks in light of those record-setting days that we've been seeing, these totals that have been climbing. Your thoughts on that?
Well, those are things that we're going to be reminded to do because we do not have a vaccine. The power is in our hand to take care of this because we don't have any particular medication that's FDA approved yet that will actually treat this. So right now, the only thing that we can do to help this go in the right direction and also to prevent exposing this to the more vulnerable people, is to socially distance, wear masks, and really refrain from large groups and gatherings, keeping our contacts small. That's the only thing that we have right now that can make a difference.
Dr. Cedrek McFadden, we always appreciate you
Thank you
coming in and helping us understand all of this. You're watching Carolina's Family at 4. We're coming right back.